What if the test your doctor is using to diagnose PCOS isn't the one catching it? What if a newer test could reveal what's been missed for years? Polycystic ovary syndrome, or PCOS, affects millions of women. But diagnosing it? That's where things get complicated. Traditionally, doctors rely on ultrasounds to evaluate the number of follicles in the ovaries and something called the Rotterdam criteria. You need 2 out of 3 findings: irregular cycles, signs of excess androgens, or polycystic ovaries. But here's the problem. Some patients don't clearly meet these criteria, and they're told everything looks normal. But now, there's another clue. A blood test called anti-Mullerian hormone, or simply AMH. AMH levels reflect the number of developing follicles in the ovaries, and in many patients with PCOS, these levels are higher than expected. So, if patients have normal-appearing ovaries on an ultrasound but has elevated AMH levels, then the patient may have PCOS. So, if this test exists, why aren't more doctors using it? Partly because guidelines are still evolving, but newer research published in the Journal of Fertility and Sterility suggests AMH may play a much bigger role than we once thought, which means patients who were once told they don't have PCOS might finally get answers. In summary, new research shows that AMH levels may be used in conjunction with the Rotterdam framework in diagnosing PCOS. If a patient has normal-appearing ovaries on an ultrasound but has elevated AMH levels, then the patient may have PCOS if they also have irregular periods or signs of elevated androgens like hair. Elevated AMH levels may replace an ultrasound finding, but should never been used alone in diagnosing PCOS. If you're experiencing symptoms of PCOS, talk to your healthcare provider about AMH testing, because sometimes the missing piece is just one test away.